Hi everyone, and thank you for watching this short video. Today I'm going to be talking about the healthy habit for the month of February, which is just an action that you can do during this month to help you become an engaged and informed consumer, which goes along with our topic for the month of February, discovering patient empowerment. In the email, you'll receive a calendar, a mini challenge newsletter flyer that will go into that topic in more detail and again help you make informed decisions regarding your healthcare benefits and your pharmacy benefits. We're going to be talking about knowing your numbers today. That is the healthy habit for the month of February. And specifically, we're going to be talking about blood pressure because February is the American Heart Health Month, which is a public health and awareness campaign observed each February that encourages people to take necessary steps to improve heart health. But it's also important to know that there are a lot of other numbers to consider, glucose numbers, any other numbers you'll receive during a screening. It's important to be aware of where you stand and what kind of lifestyle choices or medications you need to start taking in order to improve your health. So specifically with blood pressure, here is a chart that kind of shows you the different stages. On the bottom, you'll see the numbers there. The numbers are describing your systolic and your diastolic pressure. Systolic refers to the top number, and that's the amount of pressure experienced by your arteries while your heart is beating. And the bottom number is a diastolic blood pressure reading, and that refers to the amount of pressure in your arteries when your heart is resting in between heartbeats. So there at the left, you can see an optimal range versus on the right, a hypertensive crisis, something that you definitely want to avoid. Uncontrolled high blood pressure increases your risk for serious health problems, including heart attack, stroke, hypertension, cardiovascular disease, a lot of issues that you want to avoid. So if you don't know where you stand on this chart here, if you haven't had a blood pressure reading in a while, it's going to be important to do that yourself. You can look up a video of how to do that yourself or at your next doctor's appointment. Sometimes you can even do them at your local pharmacy so that you can kind of see where you stand on this chart. Next, we're going to talk about what you can do based on that number. So you get your reading and now you want to say, okay, maybe I'm in the middle, maybe I'm more towards the upper end. What am I supposed to do now? Here are some suggestions. So knowing your risk factors are important. Non-modifiable things like age, ethnicity, sex, family history, those all can impact your blood pressure numbers as well as other screening numbers. So it's important to know those things, as well as modifiable risk factors like smoking, diet, exercise, having high cholesterol, high blood pressure, which again can impact some of those other screening numbers. There are a number of lifestyle changes that you can incorporate into your routine. Participating in activities that you enjoy, spending time in nature, practicing deep breathing, spending time with family, friends, animals. Movement and exercise are beneficial for the health of your blood vessels and can also help you reduce stress. So try to choose physical activities that you enjoy and that make you feel good. Think about limiting your alcohol intake or quitting smoking. And again, manage that stress. Stress activates your sympathetic nervous system, sometimes called your fight or flight system, which can increase blood pressure. So trying to keep your stress lower is a great thing to do, as well as eating well, consuming a balanced diet like fruits, vegetables, whole grains, dairy products, poultry, fish, a wide variety of things. And paying attention to how you feel after eating certain items is also important. And again, medications can be something that would be beneficial depending on the person. So talk to your doctor to determine if and which medication would be appropriate for you to manage some symptoms or prevent complications or even manage hypertension, depending on where you fall on that chart. So again, your healthy habit for the month of February is to know your numbers. If you don't know, you can call your doctor's office, have them look up past screenings, or if you haven't been to the doctor in a while, maybe you want to schedule that appointment. and being aware of any changes that you need to make in order to improve your health and improve those numbers. Thank you so much for joining. If you have any questions, feel free to email wellness@gbsbenefits.com and we'd be happy to help you.